In progress.
Good evening, everyone, and good morning for the audiences from the US. I'm Dr. Rungnaphar Ruchop, and I'm pleased to be a moderator for today's event. This is the 9th webinar series of the MU-JSU NCD's Research Collaborative Center. And today's webinar topic is breastfeeding trends in the United States and Thailand. We have 3 speakers today to share their expertises and trends of breastfeeding in the United States comparing to Thailand. And if you have any questions, please feel free to type in the chat box and our staff will collect the questions and I will ask the speakers during the Q&A session at the end of the presentations. So now I would like to introduce our speakers. The first speaker is Ms. Rebecca Bansley, and she is a certified nurse midwife, and she received her bachelor's in human development and family science and bachelor's in nursing. She has worked as a social worker, labor and delivery nurse, and as a certified nurse midwife. Currently, she is a PhD student at Johns Hopkins School of Nursing, and her research plans are focused on the effect and correlations of biomarkers such as microRNAs, C-reactive protein, cytokines, and oxidative stress biomarkers, and the health of people and pregnant women during the reproductive years. Rebecca is here already. Hi, Rebecca.
Hello, thank you. How are y'all doing?
Yeah,
I'm very happy to be here.
Yeah, glad to see you too.
Yeah. Thank you. Well, I'm gonna share my screen to share my slide.
Could I introduce all 3 speakers first?
Oh, of course. Yes. Yes.
Thank you very much. Yes. And the second speaker is Assistant Professor Dr. Pornapa Tangsuksan. She is a faculty member of the Department of Obstetric and Gynecological Nursing, Faculty of Nursing, Mahidol University. She received her PhD in nursing from the Faculty of Nursing and Ramatipati School of Nursing, Mahidol University. And she is chair of Breastfeeding and Child Health Promoting Center and chair of the training program of nursing specialty in breastfeeding, Faculty of Nursing, Mahidol University. She also received many certificates in breastfeeding advocacy and practice, as well as teaching on breastfeeding from the Faculty of Nursing, Mahidol University, UNICEF, and World Alliance for Breastfeeding Action, Malaysia. She is the vice president of the Lactation Nurse of Thailand Association. Her current research project is a strategy development for moving forward the nutrition literacy during pregnancy 270 days of miracle life. Please welcome Dr. Pornapa. Hi.
Thank you. Hi, thank you.
And
good morning and
yes,
good evening, everyone.
Yes, thank you. And the last speaker is Dr. Shayapa Chaisuwan. She received her DNS in Nursing Education and Leadership from the Sage Colleges, USA. Now she is a faculty member of the Department of Pediatric Nursing, Faculty of Nursing, Mahidol University. She's also a committee member of the Breastfeeding and Child Health Promoting Center and the training program of nursing specialty in breastfeeding, Faculty of Nursing, Mahidol University. So please welcome Dr. Shayapa as well.
Hi, how are you?
Hi. Yes. Now, without further ado, I'd like to ask Rebecca to start your presentation, please. Thank you, Rebecca.
Yeah, of course. Okay. Very good. Thank you all. I'm very happy to be here and excited to get to participate with all of these wonderful women. It's going to get this out of the way. Oh. There we go. Okay. So, breastfeeding trends in the United States. Okay, I'm going to focus on the US. I'm excited to learn about all the things that the Thailand scholars have to share today also. I wanted to share a little bit about myself because I do think that is really important to understand a little bit more about my background. Like she said, I am a certified nurse midwife. I received a master's in nursing to become a midwife here in the US. And this is a picture of one of my clients that I had. That I was able to be present for her birth of her son. And I worked at a freestanding full scope birthing center where I got to provide care for women and families throughout the lifespan. And then this is a picture of me and my second son. I am breastfeeding him during a family photo session that we had. And I've had 3 kids. I've been able to breastfeed all 3 of them, and it was a wonderful experience. I am a big advocate for nurses getting their advanced degrees. I am getting my PhD right now, as was stated before. I think this has been a wonderful experience, getting my master's and now starting this program. And there's so many things you can do with nursing. I'm very excited about the profession. I also am a big advocate for families, and I would like to mention that I'm going to be using mother and baby in this discussion. However, that's just for simplicity's sake. I do know that some people who are caregivers who breastfeed do not consider themselves as mothers, and I respect all, identifications. Okay, benefits of breastfeeding and recommendations. So breastfeeding is very beneficial to the mother and baby. Most people understand that and know that. For most units, it will be the best source of nutrition, and it does protect the baby from many illnesses such as asthma, obesity, type 1 diabetes, SIDS, ear infections, and even stomach viruses. Some mothers and caregivers will describe it taking care of a whole plethora of other stuff. So it is very good. It increases the antibodies into the infant and builds a stronger immune system. And breastfeeding can happen anywhere as long as the community is supportive of it, which makes it a very convenient option for families. You don't have to have a lot of extra tools to make that happen. And there's also a lot of health benefits for the mother. There's decreased risk of ovarian and cervical cancers, and also type 2 diabetes, high blood pressure, a lot of health benefits for the whole dyad. Recommendations through the World Health Organization, the American Academy of Pediatrics, and a lot of other organizations recommend that we should start breastfeeding within the first hour and exclusively breastfeed for 6 months. And then you can start adding in complementary foods that are healthy for the baby starting at 6 months. And you can continue breastfeeding, for 2 or more years, depending on what the mother is comfortable with. Okay, important factors of breastfeeding promotion. So I included this diagram that was in one of the articles that I have referenced at the end of the presentation. I thought it does a great visual. It gives a great visual of the structures that we can have in place and the pieces of breastfeeding support for a mother. And so the small tiny circle at the bottom, it says intrapersonal. This is the mother and infant dyad, those two individuals. And then outside of that, it grows into the interpersonal. This is family, friends, providers, hospital staff or facility staff, the community, all the things that are interacting with that dyad. Then we go out to a little bit larger scale, and that's actually the structures that organize the facilities that mothers are giving birth in during those first few days, and that guides how much support that family will receive in breastfeeding. And then the largest circle discusses policy and system structures. How is the government supporting building a society that supports breastfeeding? Okay, and it is recommended that hospitals and birthing centers or anywhere that is taking care of mothers will actively be supporting breastfeeding. And I have a picture here in the corner of a mom on an airplane. Any societal area where mothers will be present, it's important that they have that support from those in charge and making it where they don't have to worry about or stress about breastfeeding in those locations. Having said all this, we know that breastfeeding is very, very good for family units, newborns, moms, but it's not always possible for all moms. And I wanted to, mention that. And there are other options for people who are not able to breastfeed. But research does show that even small amounts of breastfeeding, even during the first day or first few hours, can be very beneficial to the newborn. And so that support is really vital. Down here at the bottom of the slide, there is a picture of like a breastfeeding room, a lactation room where women can pump or breastfeed, and making sure that those kind of facilities are comfortable and clean are really important. Okay. Oh, I also wanted to mention other things that can support breastfeeding are things such as universal paid maternity leave, making sure that family members are able to stay home when they have the baby, having insurance that can provide the family with a breast pump or lactation consultants or supportive people such as doulas is really important. And workplaces that have specific breastfeeding times or locations where they can breastfeed and work that into their workday is really important to do that too. And making sure that the community has breastfeeding education that can happen while the mother is still pregnant, and then also at discharge, being sure that we are providing them with the education that they need to go home with and feel confident in their breastfeeding. And in the United States, we often now will have mothers room in with the baby, meaning that the baby will stay in the hospital room or whatever facility they're giving birth at, the baby will stay in that room. And that is shown to help increase breastfeeding rates. And to do that, though, we have to recognize that moms are going to need a lot of extra support and encouragement, and making sure that they're not getting too tired, that they're getting what they're needing also. Okay, so breastfeeding statistics in the United States, we have several agencies that monitor this in the US. They make reports, and one of them is the CDC. This graph over here shows looking at the amount of children that are breastfed. The blue line shows ever breastfed, then the orange is 6 months, the green shows at 12 months. And although they're not huge changes, we are seeing upward trends slightly from 2012 until 2019. 2019 was our last breastfeeding report card, our most up-to-date information. And I wanted to also point out that the exclusive breastfeeding at 3 months was about 45% in 2019, and at 6 months, about 25%. And then we also have the designation of baby friendly, and I'll talk more about that in another slide. But in 2012, it was about 7%, and it moved up to almost 29% in 2019. So that was a pretty large increase, which is a positive thing. It's showing some upward trends. Okay, so social and legislative impacts on breastfeeding in the United States. In the United States, this is a big part in our society that we're taking recognition of right now, and then also in our healthcare, realizing that we have a very large, diverse group of people in our country. And historically, there have been a lot of things that have impacted and continue to impact those individuals now. So I wanted to go over a few definitions so that everyone knew what I'm talking about when I'm discussing this. Social determinants of health is defined by the Health and Human Services in the United States. In the Healthy People 2030 report, they state conditions in the environment where people live, work, learn, play, worship, all of these things that combine to impact the range of health and functioning and quality of life that individuals experience. And because of a history of having structures that make it easier for some races of people to get the resources and the opportunities that they need, and then the structures that make it harder for other races of people to do the same thing. We've had, this is called systemic racism. And this history has transcended into all of our structures even today, and impacts brown and Black people more so than white people. And it can cause what we call health disparities, is what it's often described as. But these health disparities are not a cause of a group of people and the decisions they're making. It's the structures that have not supported them and made it harder for them to thrive in society. And healthcare is recognizing this. A lot of our society is, and they're doing active things to improve it. And this is really important for healthcare because we do know that brown and Black women have increased risk of maternal morbidities and mortalities. They die more often during childbirth. They have lower breastfeeding rates compared to white women. And so to support them, we have to do some active training to make sure that there is not implicit bias happening with providers. Implicit bias meaning that the provider subconsciously or intentionally possibly is not providing the same care among all people. And trainings that address this, making sure that everyone knows what it is and how to not do that really matters. Another piece that I have written here on the slide is representation matters. It's really important to have people that are similar to you providing care for you also. So increasing the diversity in our healthcare teams, increasing the diversity in our legislative bodies and other places of power so that everyone is represented is really important. And this all will impact the health of mothers and babies, breastfeeding, and every other piece. Okay, so this slide is discussing the baby-friendly 10 steps to successful breastfeeding. And baby-friendly was a hospital initiative produced in 1991 by the World Health Organization and UNICEF. And in 1996, that was when the first hospital in the United States was designated as baby-friendly. And it has been shown to increase breastfeeding initiation, continued exclusive breastfeeding. And I wanted to include a little bit of information about several studies that I read about when preparing for this. There is so much evidence in support of these 10 steps to baby-friendly hospital initiative. But just to list a few, the BFHI implementation, the racial gap on breastfeeding initiation has decreased significantly. There is still, like I was describing, disparities among different groups of people, but it has improved overall for all groups of people. And baby-friendly hospitals improve state levels of breastfeeding in the population. So we can see this in these national quality standards that if hospitals are initiating this initiative, the breastfeeding for the whole state changes. And that's important information for the United States because we have federal policies and then the states all have autonomy to kind of choose how they're going to implement federal recommendations. And so healthcare is very different depending on where you live in the United States, based on the states that you live in and the areas. So it's not the same if you are in New York or Texas or California. It can be very different. Or if you're in a city versus rural area. So knowing that initiating this baby-friendly into hospitals and that it impacts the community that's surrounding it is important information. One study showed that a 10% increase in baby-friendly hospitals at the state level was associated with a total increased population breastfeeding rate of nearly 5%. And that formula in the first few days was decreased by 2 to 9%. So very positive results and decreased in possibly unneeded interventions due to that increased support that women get with these steps. And the most impactful, so there's these 10 steps. I'm going to let you just look at them on your own instead of reading through all of them. But they focus on creating a structure of the birth facility and the community that, supports information and education about breastfeeding, the benefits of it, and then making sure that the woman actually has physical, emotional support to do the work of breastfeeding. And when we do that, we have found that the most important part is research has shown that the mother's perceptions of the support that she received is very, very important. And then also her view of why breastfeeding is important. So that education factor of antenatal education and then at discharge make huge impacts on the breastfeeding continuation and initiation. And several studies mentioned the importance of the perception of her birth environment, which connects to why I'm a nurse midwife. I do like to facilitate a environment where women are empowered to ask questions, take participation in their care, and be actively involved in all the decision making, which increases their buy-in to these healthy practices. And nurses that were interviewed about initiating these healthy steps into their hospital stated that there were challenges. It wasn't always super easy to do this. They had experienced some challenges, but overall they found it very worthwhile. And I did find one article that talked about the cost of implementing it, and it said that it costs anywhere between $7 to $125 per birth to implement these steps. So in the United States, that doesn't seem like a huge financial impact, especially with all the positives that can come from these for the health and wellness of the babies and mothers. And yeah, so a lot of research studies showed that us investing in these, initiating these steps in individual hospitals did have a national impact on our breastfeeding rates, which is really encouraging. Okay, so if we are helping moms breastfeed, there are going to inevitably be challenges and difficulties. So this slide is discussing the lactation consultants, managing common problems, and I have included some pictures here. One mom is used, if you can see, she has a little bottle with a tube that's connected, taped to her, and then put inside the baby's mouth. That's a supplementer tool. Then we have this mom at the bottom. She's doing skin to skin. And we have this other tool on the side. This is a colostrum collector. All of these things, and there's a plethora of other things that can be helpful to moms, but these things can really help and facilitate breastfeeding when it's not easy. And I'll go into a little bit more detail about the details of those. But in the first few days, we know moms give birth, they might be tired, they are having a hard time just taking care of themselves. So making sure that the mom is well cared for, comfortable, fed, and has all of her needs met so that she can give those give attention to the needs of the baby is really important. As the milk supply comes in, mom's breast may become engorged and may be very uncomfortable. So giving her the education on knowing how to manage that. And babies' mouths are so small during that time also, cracked nipples or sore spots can happen. And so helping her learn how to actually get the baby latched on properly, having ointments that can help, or nipple shills, things that can take care of those painful areas will be really important also. And like I said in the last slide, the mother's experience during this time, the support that she felt or the lack thereof is really important and has to be acknowledged. And that is going to be a vital part of her continuing breastfeeding while she goes home and is on her own. And when she gets there, her family support will also be really important. So there are things that can cause breastfeeding to be a little bit more difficult, such as if your baby gets sent to NICU, or if you had a lot of IV fluids or medications during the labor. All of this stuff can increase swelling, make the baby maybe be a little bit more fatigued. And knowing that and acknowledging that as staff, we can give those moms who have those interventions a little bit extra support and check in on them a little bit more and making sure that they are getting what they're needing. And I talked to a lactation consultant to make sure that, I was sharing some good information for y'all. IBCLC is the certification that you receive here. You do a lot of training hours and then you end up taking an exam at the end of all your training. And it's a very rigorous process. And her number one recommendation for helping moms be successful was doing skin to skin contact for those first 3 days. And I have seen that with all of my clients as well, that when moms are able to do that and be free and not worried about people coming over and them having to be dressed and conservative, but having that openness to just wear baby right here on their chest, and baby's just in diaper, it really does initiate the baby to wake up more often, increase in activities, and then her milk supply comes in quicker, so making that process a lot easier for the whole unit. And the next slide is just a list of breastfeeding resources that I had that people might find interesting. One that I often reference to is kellymom.com. That's in the United States. Bundle-born midwifery was midwifery and / lactation that y'all might enjoy. Her website is very beautiful. And then all of these, big organizations have a lot of good information. And then here are my references. And that is all.
Thank you so much, Rebecca. Thank you so much for the wonderful presentation, and thanks for sharing us the background about the benefits of breastfeeding and also the trends and what you're doing in the US. And I can tell that you have lots of experiences as a certified nurse midwife, right? To take care of the baby and the mothers. And I can see some nurses supports are quite similar to Thailand, but some are still different. So then that I would like to ask Dr. Pranapa and Dr. Shiyapa to present the breastfeeding care and practice and also education in Thailand. And before we start, just to remind the audiences again, if you have any questions, please feel free to type in the chat box, and we are going to discuss at the end of the presentation. Okay, thank you. So now I would like to ask Dr. Pranapa to start, please.
Thank you, Dr. Lungnapa. I would like to say thank you to Rebecca. Your presentation is wonderful and helped me a lot as you provide the significant aspect and the figure that I not need to say all the things that you say before. And I would like to good morning all participants in the United States, and good evening all participants in Thailand. Welcome to my presentation. First of all, let me thank you all for coming here today. That is really early in the morning and a bit dark in the evening. Thank you to the committee of the MUJSU NCD Research Collaborative Center who organized the 9th webinar meeting for inviting me to share experiences in this webinar. In our presentation, we will focus on like 3 to 4 major issues. Firstly, I will talk about some significant statistics and indicators globally and narrow them down to breastfeeding trends in Thailand. In addition, challenge will address. Secondly, Dr. Shiyapa will present trends of breastfeeding for 6 babies in Thailand. Finally, I will talk about our working experiences in the Breastfeeding and Child Health Promoting Center of the Faculty of Nursing, Mahidol University, which includes a training program of nursing specialty in breastfeeding. As you look at this picture, what can you see? I would like all to say something or type something in your chat box to make you wake up. Okay, as you look at this picture, what can you see? Globally, WHO UNICEF targets exclusive breastfeeding 6 months for 50% by the year 2025 and 70% by the year 2030. Recently, the worldwide exclusive breastfeeding 6 month rate is around 44%, by the year 2021, we can say that the 2025 goal, which is 50%, is near to reaching. However, the 2030 goal is something that will take a lot of effort to reach. For Thailand, we target 50% by the year 2025 similarly, but only 14% will reach. The question is it possible for us? I would like to say that I'm not talking about what the numbers should be, higher or lower, but rather concerned about the health, development, and survival of the children, including the health of the mother, as the benefit that Rebecca said. We all are familiar with this. Next slide, please. We all are familiar with these SDGs figures. It is well known that breastfeeding is associated with several SDGs, especially the first indicator, no poverty. Breastfeeding is a national and low-cost way of feeding. For the third indicator, good health and well-being, breastfeeding significantly improves the health, development, and survival of children. It also improves the health and well-being of mothers, both in the short and long term. Next slide, please. This picture shows breastfeeding trends in Thailand. The yellow is the recent breastfeeding rates, which are in 2019. As we look, our breastfeeding rates dropped in 2019, which was a year before COVID-19 came. Particularly exclusive breastfeeding 6-month rate dramatically dropped from 23 in 2015 to 14 in 2019. However, relevant organizations review to come up with strategies to solve these challenges. Thank you, Dr. Chayapa. Dr. Chayapa, who controlled the PowerPoint. This slide for health target in Thailand, the maternal mortality rate achieved a global standard, but is still far from the national goal. For child health, although the under 5 mortality rate already achieved global and national targets, we are rather challenged with stunting, wasting, and being overweight. Especially wasting and overweight number are increasing. Focusing on overweight is similar to the developing country or high-income countries. Interestingly, as we know, breastfeeding is a part of this answer to this problem. Let's see what are Thailand's efforts to protect, promote, and support breastfeeding. I would like to show you the overall picture. Then I will explain some of them. Breastfeeding support at the policy level. These are baby-friendly hospital initiative, breastfeeding support in the community, breastfeeding support at workplace, and the legislation effort to make a global standard to be the Thai laws happen. Firstly, and next slide, please. Baby-friendly hospital initiative was implemented in government hospital. The hospital were encouraged to deliver services according to the 10 steps to successful breastfeeding. Various training activities and relevant information were provided to all hospitals. And if you look at the slide, last slide, please, Dr. Shayapa. Yeah. Parental school, the next, your right hand. Parental school is a strategy to help mothers to understand how they prepare themselves during the prenatal period and be ready for the upcoming situation, including breastfeeding methods in later periods. And the next slide, please. And Miss Nome or lactation nurse specialist who provide breastfeeding support in hospital and in community. And this slide show breastfeeding support in the community. There is a sub-district breastfeeding support program. Village health volunteers are trained to provide breastfeeding support for the family they take care of. They provide home visits and basic care for all lactating mothers. Next slide, please. In addition, breastfeeding support during a pandemic or emergency was initiated, as breastfeeding must continue, especially amid the pandemic. Mother milk will best protect them from infection and illness. This word is said by Yung Sun Kim, UNICEF representative for Thailand. The third policy at the workplace, many projects were implemented, including the Mother-Friendly Workplace Program or Breastfeeding Corner, initiated by a collaboration of 7 significant sectors. It was initiated by the Department of Labor Protection and Welfare, Ministry of Labor, in collaboration with the Department of Health, Ministry of Public Health, the Thai Breastfeeding Center Foundation, UNICEF, WHO, and Bangkok Metropolitan. At the workplace, the project of Mother-Friendly Workplace or Breastfeeding Corner was initiated. The project includes training, coaching, and provide a handbook on how to set mother-friendly at their workplace. There are 1,400 companies that participated in the program, 16 model companies, and 5 best practice companies. This slide shows the project of Transportation Express breast milk by bus with free of charge by both public and private agencies. Mother can send their express breast milk to their relatives who take care of their child in another province when mother have to separate because return to work. In case of maternity leave, it was found that in 2019, Thailand extended the duration of paid maternity leave from 12 weeks to 14 weeks, which is compatible with a global standard. For government employees, they can add unpaid maternity leave with not more than 150 days and are entitled to father leave with 15 working days. Next slide, please. This slide is a success for the efforts of all parties involved. Since the Code of Marketing of Breast Milk Substitute was launched in 1981, finally, Thailand was able to make the code enact into law in 2017. Over 36 years of driving. This is a big celebration in our country. According to challenge, so my time is end at this slide. According to challenge. Data demonstrate that we face many. There are 10 key indicators that address policy and programs. Each indicator is account for 10 points. The total score is 100. Thailand average score is 60.5. It was ranked number 43rd among 98 countries and ranked 4th among 9 countries in the East Asia and Pacific region. Thailand has, in this picture, Thailand has good policy and program in 4 indicators, including baby-friendly hospital initiative, information support, infant feeding and HIV, and monitoring and evaluation. However, some indicators need more efforts, such as national policy, program, and coordination, implementation of the international code, maternity protection, infant during emergency. Finally, from my first part, there are challenges that need to be concerned. Another slide, last slide for this first part. Firstly, next slide, please. Challenge. I would like to present challenge in Thailand. A baby-friendly hospital initiative policy, lack of continuous support. So the exclusive breastfeeding 6-month rate is dramatically dropped. Several community-based and workplace programs face challenge from competitive agendas. Ineffective enforcement, violation by breast milk substitute industry, the labor protection law needed a significant boost. And for the suggestion that I would like to talk to is revitalize the BFHI implementation and extend it to private hospital. Second, increase financial and human resource investment and support. And lastly, implement the active surveillance of violation and strengthen law enforcement. Thank you. For my first topic or first part. Okay, Dr. Lungnapha, I will give this time to Dr. Shiyapha Light.
Yes, thank you, Dr. Panapa. And then Dr. Shiyapha, you can continue, please.
Okay, thank you so much. Thank you, Dr. Panapa, and thank you so much for the opportunity to speak this evening, and thank you for the invitation to come and share with you. Okay, as Dr. Panapa presented about the statistics of breastfeeding or exclusive breastfeeding in Thailand, the policy used to promote breastfeeding, and the project and activity developed to promote breastfeeding in Thailand. For this part, I am talking about a very specific thing, the trends of breastfeeding for 6 baby in clinical setting in Thailand. As we know that the breastfeeding is very useful and can help 6 baby to speed recovery because breast milk contains a host of antibody and other protective factors that help to protect against viruses, bacteria, or other foreign substances. Okay, for the definitions of 6 baby, 6 baby means a child from birth to 2 years of age who got sick from any cause during their periods of breastfeeding. For example, they are diagnosed with preterm birth, NEC, respiratory distress syndrome, sepsis, jaundice, or birth defects. Although the promotions of breastfeeding is very much focused on healthy children, WHO, UNICEF, the Breastfeeding Promotion Organization, including Thailand, US, and around the world, also focus on encouraging 6 baby to be breastfed or receive breast milk. For the situation and challenges of breastfeeding 6 children or 6 baby in Thailand, these include The majority of breastfeeding policy and promotion focuses on healthy baby rather than sick baby, and sick baby or sick children are often limited in their ability to breastfeed. And mothers with sick baby often have anxiety or stress that affect their milk supply, or this make them cannot be able to continue breastfeeding. And the COVID-19 pandemic, because today the transmission of active COVID-19 through breast milk and breastfeeding has not been detected, but in the clinical setting, the policy to visit sick baby, breastfeeding sick baby, or expressing and storing breast milk for sick baby has taken more steps to prevent infection or spread of infection. For example, mother must show the ATK or RT-PCR test result each time before they come to the ward to breastfeed. I think this can be barrier that affect breastfeeding in clinical setting. For this slide, I'm gonna show because human milk is a preferred food for sick and not sick baby, confirming skill and complete breastfeeding support for this vulnerable infant require a specialized approach. Although WHO hasn't developed a 10-step for successful of breastfeeding for sick baby, but Thailand has followed and 10 steps for promoting and protecting breastfeeding for vulnerable infants or sick baby. Dr. Diane Spad, she is an international known expert in the field of breastfeeding and human lactation. She is a chair of American Academy of Nursing Expert Panel of Breastfeeding. This policy was implemented in Thailand in the first year is 2013 with 6 hospitals. And today the number of hospitals adopting this policy has continually increased. Okay, while the 10 steps of successful breastfeeding are important steps for successful initiation of breastfeeding in the birth hospital setting. They focus only the healthy or full-term infants. Therefore, 10 steps for promoting and protecting breastfeeding for vulnerable infants is a good choice to follow for promoting breastfeeding in sick baby. Okay, let me briefly explain for and 10 steps for promoting and protecting breastfeeding for vulnerable infants. According to the step 1, informed decision, all women should be educated about the benefits of breastfeeding. However, a woman experiencing a known high-risk pregnancy should receive special education and guidance about specific benefits of human milk or breast milk and how to get the best start on lactation after delivery. Nurses sure that they have a good responsibility to serve as a patient advisor and inform family about why human milk is important for sick baby should be standard nursing practice. And for step 2, establishment and maintenance of milk supply. Yes, an infant should be breastfed within the first 2 hours after birth. When infants are born with complication, lactation must be initiated via pumping. Pumping must mimic the pattern of healthy breastfed infant. It needs to occur 8 to 12 times per 24 hours. This is appropriate for sick baby. And for step 3, human milk management. Nurses are integral to breast milk management. For pumping or storing breast milk, nurses must work with mother and family on a daily basis to ensure milk safety and prevent unnecessary wastage of breast milk. And for step 4, oral care. As we know that colostrum contains a powerful mixture of concentrated components that include immune protecting agent as well as microbiome promoting agent. So human milk directly from the breast is obviously best. However, for most vulnerable infants, especially sick infants, this may not be an option for several weeks or months. Therefore, when enteral feeding are initiated, colostrum should be fed for the first 24 to 48 hours to mimic the natural process. Okay, according to step 5, skin to skin care or kangaroo care, the nurse is a key member of the healthcare team in promoting skin to skin care. From a breastfeeding perspective, skin to skin care can improve maternal breast milk production and can help establish breastfeeding and can increase breastfeeding duration. Moreover, skin to skin care can reduce stress, improve oxygenation, and weight gain for infants. And for step 6, non-nutritive suckling at the breast. This step should be initiated once infant has been extubated. Non-nutritive suckling at the breast can improve the transition to breastfeeding for nutritive purposes and is associated with longer breastfeeding duration. So for this part can improve the duration of breastfeeding. And for step 7, transition to breast. For this part, the mother can switch from non-nutritive to nutritive breastfeeding session. When infant mature and is able to latch, nurses are principal to providing mother with maximum breastfeeding attempt. And for step 8, measuring milk transfer. This is we should use the technique test weighting. This is an effective method for measuring milk intake both in the hospital and after discharge. The nurse is responsible for instructing the mother and family on the procedure for test weighting. One study pointed out that mothers who performed test weight had lower anxiety score. And for the step 9, preparing for discharge, again, the nurse play a critical role in encouraging and supporting the mother during this process. When assisting the mother with breastfeeding during this time, it is crucial to be knowledgeable about the mother normal milk production pattern, assess total daily production as well as variation during the day and between each breast. So the skill to assess and evaluation for nurse is very important. And the last step, step 10, appropriate follow-up. This is very important because can improve the continuity of breastfeed. The nurse should instruct the mother that all breastfeeding sessions should be monitored with the scale until the infant demonstrates the ability to take or feed from the breast. Okay, for this part, although it might be a bit more challenging, it's important to continue breastfeeding because human milk may be the best medicine for sick baby. The breastfeeding process for the vulnerable infant is a long and often challenging process. Nurses are critical to breastfeeding success for this infant, and specialist lactation support, healthcare profession support, and training and necessary practical equipment are important factors in solving the difficulty of breastfeeding. Okay, for this part is thank you very much and thank you for attention. And for the next part, Dr. Ponnappa will present about breastfeeding and child health promoting center and training program on nursing specialty in breastfeeding. Dr. Ponnappa, please.
Welcome back. Thank you, Dr. Chiyapa. For this last 5 to 6 minutes, I will talk about our working experiences in the Breastfeeding and Child Health Promoting Center of the Faculty of Nursing, Mahidol University. Our work covers with 3 areas: academic services, and research. Let's talk about some important work that we address. Next slide, please. This picture is a historical picture. Faculty of Nursing Mahidol University and UNICEF Thailand signed MOU to develop a breastfeeding curriculum for undergraduate nursing students in 2009. As prior to that time, breastfeeding contents are scattered in various subjects of nursing school, which may affect the effectiveness of teaching and learning. Consequently, newly graduate nurses may lack the knowledge and skill on breastfeeding aspect. So we expect this curriculum will increase their breastfeeding knowledge and skill to support mother. Next slide. This is prior slide. Dr. Chayapa, next slide, please. Next to this slide. Before we develop the curriculum, we train nurses and health personnel in order to have a view of cognition and skill in the same way. There were 8 pilot nursing schools participate in the project. Next slide, please. We developed teaching material including learner guide, trainer guide, PowerPoint, computer assist instruction, video, and breastfeeding learning bags for practicing. Next slide, please. We developed breastfeeding training course on both short course and long course for attendees from national and regional. This is our work. Next slide, please. Another significant step is the development of the first training program of nursing specialty in breastfeeding in Thailand, accredited by the Thailand Nursing and Midwifery Council of Thailand. This is very important because prior to the development, nurses in Thailand were trained only 20 hours of training along the UNICEF recommendation or attend the short course training on their interest basis. Therefore, fully standardized training aims at developing up-to-date knowledge and skill with evidence-based practice may enhance. The Department of Health, last slide, not this slide, prior slide. The Department of Health, Ministry of Public Health, therefore saw the importance of this course and signed an MOU with the Faculty of Nursing Mahidol University to send nurses across the country from all provinces to participate in this training course. Next slide, please. In addition, we also organize various activities at workplaces and various groups that are relevant to breastfeeding support, like the elderly support group. Next slide, please. We arrange many conferences continuously, particularly during World Breastfeeding Week in August. Next slide. And next slide. Therefore, World Alliance for Breastfeeding Action certify and send the certificate of participation to Faculty of Nursing. Next slide, please. Another is we established the Lactation Nurses Association of Thailand in 2018. Next slide, this slide. During the COVID-19 pandemic, when mother and their families were having a hard time, we initiate hotline counseling to help those who face breastfeeding problems and also maternal and child challenges, both physically and mentally. So this is our team. At first, we provide a hotline only like a post office time, and the second infographic, we provide the hotline counseling during the office time and out of the office time, and then we extend we have the support from other colleagues to help to provide this service to mother and family. So this is our work. Next slide. About the research, we established a research database and develop research projects. And if you see the pink color is the breastfeeding database is also in Thai journal. The left hand is in Thai journal and the right hand is like an international journal. So we provide this database for Thai healthcare personnel. And for research, in our team, we like do many of the project of research, and many of them are still ongoing. Finally, I will end with the next step of our center, including firstly, on academic part, we are working with the Thailand Nursing and Midwifery Council in developing a breastfeeding curriculum for undergrad nursing students by using the entrusted professional activity model, revising the training program of nursing specialty in breastfeeding. As the problem is nurse cannot come to study in this program full time. So we try to develop the revising program like a tailor-made to them. So it might be a lecture for 2 months, and then lecture for 2 months we provide online, and then the next 2 months is like a practicing on site. So this is our work on academic part. The second part, academic services, we try to we have a collaboration with Bangkok Metropolitan to initiate a continuing breastfeeding support program in communities. We like the project, and we are like a plan together, and we'll do this project in this year or next year, collaborating with the private sector to provide information, counseling, and support for mother and family via application. And the next part, research. We hope that we can make like a relationship and like to do research interdisciplinary with other institutes, like with John Hopkins. Okay, that is our work that I would like to present. It's not all, but part of it that I would like to address too. Thank you. So I will give the stage to Dr. Lungnapha.
Thank you very much, Dr. Ponnapha and Dr. Chayapha, for the excellent presentations. And we have known a lot that in Thailand, we are providing so many services to support breastfeeding, right? In all areas, like in clinic, in practice, in education, and also in research. And there are many factors and challenges that we still have to overcome and to improve to have the better services in the future. And right now I would like to move to the Q&A session. So we have couples of questions right here. I think the first question is for Rebecca. So the question is that, how do you promote and support breastfeeding among working mothers in the US?
Yes, well, Dr. Purnapa and Chayappa, thank you so much. That was so informative. And I think it really answered a big portion of the questions I saw in the chat also. For working moms in the US, well, the main thing that will help moms is that we have legislation that supports mothers in ensuring that they can pump at work. If they have to go back, that they have a location that is clean and bring their equipment, and that they get that time to actually take off and pump. But I think the education, the nursing staff, and the people who are taking care of women while they're in it and as they give birth and right when they're going back home, and the family, the community support, all of that makes sure that everyone understands the importance of breastfeeding, so that the mothers will be motivated, because it's not easy. Pumping and, it takes a lot of effort. So that is, the education is so vital in understanding the importance of it. And then in the US, we still have a lot lacking in the maternity leave and ensuring that they have time off. So I think that is one of the most important pieces, is that mothers, after they give birth, they need time to heal and stay at home, do that skin to skin, and feel ready to, sorry about the sound in the background, but feel ready to go back and do what they need for their work. And having family members that can stay, like paternity leave, having those family members be able to stay home and take care of the infant if possible is also really supportive.
So I would like to ask the question that would be related to the previous question. How long is the maternity leave in the US? Usually?
How long is maternity leave?
Yes.
Yeah, so some places do not have any maternity leave at all, like paid maternity leave. They may have to use their vacation, save up vacation. I'm so sorry. There's something outside that is very loud, so I apologize for that sound. Or they may have there's something called extended leave support that they can like pay for before they get pregnant, so they can like buy into this insurance, and then that helps support them so that they can get paid leave. Other places, there are some companies who give them 3 months. That is like an ideal time. 12 months is a common practice if they're going to give maternity leave. Or there are some companies that even give 6 months to 12 months of leave. But for the majority of women in the United States, paid maternity leave is not a guarantee.
Oh, I see. So it's pretty challenging to have the long maternity leave, in my opinion, right? So they have to prepare many things, especially for the money, for the salary that they have to be cut off during the leave.
Yes.
Yeah.
Yes.
Yeah. So I think
that is contributing to that contributes to the disparity for the people who have the most challenges. Usually those jobs that they have are not as supportive of maternity leave as other jobs that are taking care of people who already have better income sources.
I see. Thank you very much. And you have mentioned about the social disparities problem, right? And I think in some populations that they have the lower income already, so it would be difficult for them to have the maternity leave for the very long period. Right. Thank you, Rebecca. So I think I would like to ask this question to Dr. Ponnappa and Dr. Shiyappa as well. Like, how do you promote and support breastfeeding among working mothers in Thailand?
Yes, thank you. For working mother in Thailand, I have I did research when I study in a PhD program that the factor influencing exclusive breastfeeding in Thai working mother. So I used ecological model to see what personal factor, community factor, and policy level that affect to exclusive breastfeeding in this group of mother. And I would like to know what is the interaction among these three group of factor. The result come up with the attitude of the mother is significant, but is like a have a high association, but the attitude, this attitude is not the attitude as we know. We always knows about the attitude of mother about their attitude on benefit of breastfeeding. The attitude that I found is the attitude on the context of their life, and then they decide or not decide to exclusive breastfeeding their child. For working mother, especially for low income mother, they see at their context and their life context, and like they know have they bright how to breastfeeding their child, so they quit breastfeeding before they return to work. And the second factor is the hour of work. In Thailand, Thai mother work like at least 9 to 10 hours, and most of them work like overtime until 8 or 9 p.m. So their income is significant. So these two factors is interact together: attitude on their life context, on their life context, and the attitude on they have low income. When these two factors is interact together, exclusive breastfeeding is had influencing on exclusive breastfeeding, and most of them quit like 80% before they return to work. So in Thailand, so we have to extend, we need to extend the maternity leave of Thailand. But I think that in Vietnam, Vietnam have 6 month maternity leave already, but that is not help or is not improve exclusive breastfeeding rate in Vietnam. That is why, because most of working mother, their main concern is their income. They have many expense, like during they leave from their work, but the expense still there. So they need to come to return to work early to make them have income and can expend this money for their life. So in Thailand, if you would like to help working mother to like breastfeed their child, we need to talk and to listen to the mother. What the mother need is not the maternity leave. If the maternity leave, they like paid maternity leave, not like unpaid maternity leave. If you provide unpaid maternity leave, they do not want to use it, so they return to their work and quit their breastfeeding. So the policy maker have to tailor-made and have to listen to this group of mother and decide what the maternity leave is matched to them. Thank you.
Thank you very much for the answers from Rebecca and Dr. Ponnappa. And I would like to move to the next question. What kind of support or strategies you give to mother who have baby in NICU to maintain the effective breastfeeding? I think perhaps like all of you can answer.
Okay, is
Yeah.
your first one? Okay. This as a slide, I think that as I showed that although the WHO hasn't developed a 10-step for successful breastfeeding for 6 baby, mostly they focus on well baby or full-term baby. So one of the good choice, as I show you the step to successful breastfeeding for 6 baby of Dr. Diane 10 step. In Thailand, I noticed that mostly breastfeeding have a problem when they discharge from the hospital. As in ICU, they have a strong support from nursing professional or doctor, but when they get home and need to follow up continually, so support for this period is very important to follow, and this is maybe have limitation in Thailand to support and follow up after they discharge from the hospital.
So I think that the most difficult part is how to support them to continue breastfeeding right after discharge.
Yes.
Do you face the same problem in the US, Rebecca?
Yeah, I agree. I think just like what both of you have mentioned, that listening to mothers is super important, asking those questions and making sure that we know what they need, and then like providing that service. That's like the key vital piece. I think we do if the mother gives birth in the hospital, which if she's having a baby go to the NICU, then that's probably where she gave birth. We do have breast pumps available for every hospital, and then they can rent them if they don't have funds for it. We also have programs called like WIC or other Medicaid and those kind of things that can help the mother get the food and nutrition that she needs and supplies to pump so that she can keep her milk supply during that time when the baby is in NICU. And then those tools that I had mentioned, like to catch the milk or like storage and all those things are really important. For babies and moms who breastfeeding is not successful, where the mother is not able to maintain a milk supply, then there are milk banks, which I think Dr. Purnapa had mentioned that also in Thailand. But good thing.
See, thank you. So the next question is that in Thailand, we found that a dramatic decrease of the exclusive breastfeeding rate in the first 3 months before mother returned to work or school. Could you please share some opinions or experiences? How can we solve this problem, especially for mothers who live in urban area or metropolitan? Yeah,
Yes, I think this question is mine.
yeah, I think it's great.
Thank you, Konkanok, who asked the question. This is a very good question. It's hard to help. It seems like hard to help the mother who live in urban area, especially in Bangkok. As you know, in Bangkok, some mother come from other province. They come to Bangkok and work. And then when they deliver baby, they send the baby back to their hometown. So they live in Bangkok, but their baby live in another province. So how can we help this group of mother? I think about the third step of 10 steps. Antenatal period preparation. We had to talk to the mother that they can provide breastfeeding during their work or during the time that they send the baby back to home. As I show in the slide, we can send express breast milk to their hometown, to the relative who take care of their children. So we need to prepare this group of mother, talk to them and plan together with them. And what is their plan after they deliver the baby? So we have many strategies to help this group of mothers, but we have to listen and plan together. Thank you.
Thank you very much. Yeah, it's very, very challenging, and we need many supports from and also the policy, right, to support this group of women to continue breastfeeding.
Yes, also about daycare at workplace. But this kind in Thailand, as we know, we have problem about daycare also. So most of family like not trust about the quality of the daycare, but they trust their relative to take care of their child.
See, So it's really difficult, as you have mentioned that many people come from other provinces and probably their family members are not here in Bangkok. It's very challenging to send the breast milk to ship to other provinces also. Yeah. So is that the same as in the US, Rebecca? I'm not sure. Like usually I know that in the US they don't stay together with the family members mostly, right? After they get married, and then they're gonna just stay with the husband. And do they have like
Yeah, yeah. Yeah, so I would say it's much more common for family. Sorry.
Yeah, please continue. So I think
Okay.
delay a little bit.
Okay. I think that for a majority of families, they do utilize childcare, and a lot of families do not live with their immediate families. The grandparents live in different homes. However, a lot of families do utilize their relatives to keep their children, especially since COVID has happened in the last few years. Families have not been able to utilize childcare as much, and the way that finances have changed and inflation and those kind of things has impacted. I don't have statistics, but I've heard a lot of people discuss about not being able to find places for their children to go to for childcare, part-time childcare. So if they're not wanting to send their kids to a school every single day, it can be difficult for them to find that care. Or if they're not able to pay for a nanny to come in and take care of their child every single day and pay like a full living wage for that nanny, it can be really difficult. So fill in the gaps in that area. And if the parents do not have that good maternity, paternity leave, then it can become really difficult. And there is research that has looked at how since COVID, the amount of mothers that had to leave the workforce because of that. And financially, maybe we are able to support that easier. A lot of families could, have a mom or dad stay home with the children, but it has been a big change in the last few years and impact on the family.
Oh, I see. Yeah, and it's more difficult during the COVID-19 as well. If the family cannot support the children to go to daycare, and then they have to take care of them, the baby at home, and they cannot even work, right? I think the past period of the pandemic was very challenging.
Mm-hmm.
Okay, so we are running out of time, so I'm trying to wrap up a little bit. So the next question is that, do you have any plans to organize a remote training course for breastfeeding consultants? Dr. Please.
Yes, sure. Now we develop the training course, and for breastfeeding consultant, it might be in the future. And as you know, the IBCLC, the International Board Certified of Lactation Consultant is the international certified board. I heard that it will translate in Thai language. If we have 30% to apply the course in Thai, so it will translate in Thai language, and you can apply and certify with this board. And for our faculty, we plan to develop the course like a basic course, advanced course. So the consultant might apply for the advanced course in the future, coming soon. Okay. Yeah.
We must use the technology.
Yes, and remote. Yes, now we think about remote, not on site, study like a learning. We have like a plan online or remote training. Yes.
Thank you very much. So I think the last question from Yamin, I think Rebecca, correct me please if I'm wrong. She asked like the US, are there any national laws of maternity leave that you have mentioned that there's not?
Yes,
No, there's
already
no
mentioned. Yeah.
yeah, no paid maternity leave that's in a law, but the law states that you can have up to 12 weeks of unpaid or paid maternity leave without being fired from your job,
I see.
but it doesn't ensure payment.
Okay, I see. So I think this is a question from myself. Okay. So I know like one factor, especially the cesarean section, and it's very, very common in Thailand. And I think this is also one factor that many mothers cannot continue the exclusive breastfeeding. I would like to know like whether is it the same problem in the US, like when mothers get the cesarean section and they cannot continue the breastfeeding.
Yeah, I hit that a little bit. I didn't mention C-section. I'm glad you brought that up. So any intervention during birth, such as inductions, or if a mom has a lot of IV fluids, or if a mom has a C-section where she has increased, like outside of the physiologic birth, she's having to have that extra healing. She also got that extra medication, all of those things that are relating to her body. It does impact the breastfeeding. It can impact the breastfeeding rate here also. But the thing I like about the breastfeeding, the baby friendly hospital initiatives that we've implemented here too, from what I've experienced, even seeing people and the after C-sections, we do like immediate skin to skin, even in the surgery. Not all facilities, but ones that are supportive of breastfeeding, they try to put the baby skin to skin as soon as possible, or they'll put skin to skin with the partner so that the baby is really alert and active while the mom is transitioning back into the post-surgical area. And then making sure that the postpartum nurses have that education on how to support the mom. So that research that talks about the mom's perception of support and the education that she has on the importance of breastfeeding, I think those are the most important pieces. So no matter what kind of experience she has in being pregnant and giving birth, if she has the support and the knowledge, then women can overcome those difficulties. And any of those interventions will be a challenge and increased challenges because she'll have more discomfort, and the breastfeeding initiation might be delayed, or they some things that they have to overcome, but the support can make that challenges doable.
Thank you so much, Rebecca. Would you mind if we stay a little bit longer for 5 minutes? Because I just saw the last question here. Okay. In Thailand, we found that mothers face many difficulties for keeping exclusive breastfeeding after discharging from hospital. And many of communities organizations work with healthcare providers, such as village health volunteer, pre-group, or etc. And how about trends in the US? Do you have like?
Yeah, I think a really popular group is the La Leche League, and your group of in different communities, and they also are available online or through phone, if needed, but they provide that peer support for breastfeeding. And locally, there will be a lot of individual breastfeeding support groups. I found also that moms find support in just spending time with other women. So maybe like going to the library, they'll find their support through that way. And the activities that, are in the community. But I think that the partner and the family support is really important then in those cases. So if a mother or a mother-in-law or a husband, that is supportive of breastfeeding and helps facilitate that is really important too. People in the US who have that support end up doing better. There was research also that's talked about how if your mother breastfed, then you were more likely to breastfeed your baby. So that, that close connections is really important.
Yeah, totally agree with you with this step. Okay, thank you so much. I think we are at the end of the event today, and thank you so much on behalf of the MU JSU NCD's Research Collaborative Center. I would like to say thank you to all of you that have been sharing the very interesting and useful information about the breastfeeding trends in the US and also in Thailand. And I would like to ask all the participants to complete the evaluation that our staff have sent in the chat box already. And I will let you announce that we still have another webinar coming this year. And so please follow us on Facebook, Twitter, and YouTube for more information for the next webinar topic, date, and time. So we will be uploading this presentation on YouTube as well. So please follow us. And thank you so much again. And Rebecca, thank you for waking up early and joining us and sharing the information. Thank you. And Dr. Ponnappa and Dr. Shyapa as well for your information. Also, hopefully to see you again next time. And so have a great day, Rebecca, and audiences from the US, and have a good night for Thai audiences. Bye-bye.
Thank you.
Thank
Bye
you.
bye,
Bye.
Rebecca.
Have
Have a
a good
great
night.
day.
Yes. Yeah, you too. I'm so happy to have worked with y'all.
Yeah. Wish to see you in Thailand,
Yeah.
Rebecca.
Yes.